Every 2.5 minutes, someone is diagnosed with lung cancer. And in fact, in 2022, nearly 6,000 New Jersey residents will be diagnosed with lung cancer. And this morning here on the Jersey Magazine, I have two guests, Dr. Sabia Hussain and Emily Amotin, with the American Lung Association hosting the 8th annual Lung Force Walk in Bridgewater at Duke Island Park. Dr. and Emily, good morning and welcome to the WDHA Jersey Magazine.
Hi there.
So,
Hi, good morning.
The first thing I want to ask you, and Emily, I guess I'll send you this question, is how do people register for this walk?
Sure. It's easy as going to lungforce.org, and I'll spell that out for you, lungforce.org/Bridgewater.
Okay. And again, that is on Saturday, September 17th. Dr. Hussain, how has COVID affected lung cancer?
It has decreased the number of individuals actually seeking care because people have sort of not been going to their doctors regularly for follow-up. And two, it has made individuals who have cancer at increased risk for getting COVID. And so from that standpoint, it has affected both care as well as increasing risk of getting complications when they are getting their care.
And I started off our interview by saying that every 2.5 minutes, someone is diagnosed with lung cancer. And, that seems like a staggering statistic to me, Dr. Hussain, because, I was thinking the majority of people I know either don't smoke or never smoked or have quit. What are some of the other contributing factors to lung cancer?
Yeah, so, in addition to having cigarette smoking as a risk factor for lung cancer, there are other risk factors that go along with lung cancer. Certain things like environmental exposure. So we know that individuals who are exposed to like biomass and biomass fuels have increased risk for lung cancer. There are also, genetic risks related to lung cancer. We know that if there's a large portion of women who've never, ever smoked, never smokers who end up getting lung cancer. So there are definite other contributions to lung cancer that we all have to be aware of, in addition to smoking.
Emily Amotin is the New Jersey Development Director for the American Lung Association. Emily, what goes into planning this walk? You've been doing it now for 8 years, the association. What goes into planning it?
Absolutely. I mean, a lot goes into planning it. It's a year-long process, I would say, to bring the group together, community members from across northern and central New Jersey to our site at Duke Island Park to walk with us each year. So definitely a lot of work goes into it. The big part of that is with our leadership committee and our leadership board, and of course, through the support of our medical honoree, Dr. Hussain.
And what is the goal this year in terms of awareness and or fundraising?
Absolutely. So our goal, fundraising goal, obviously is $165,000, and we feel confident we're going to be able to reach that and help fund our annual research, education, and advocacy initiatives. And we're on target to have about 400 people out at Duke Island Park, which is awesome. We're still building back up from pandemic years, but we expect a really great turnout.
Dr. Hussain, what kind of changes have been made? What kind of improvements have been made in the detection and treatment of lung cancer in recent years?
Yeah, so there's been a lot going on in relation to lung cancer screening. We know that have been lots of research coming out saying that individuals who are screened and are detected to have cancer and picked up early have decreased risk of mortality or death. There's also been a recent statement that came out that decreased the age requirement in terms of screening from 55 to 50, as well as the number of years or smoking exposure down from 30 to 20. So I think that has left it open for many more individuals to get screened. We know that only 6% of individuals who qualify to get screening get screened. So we are trying to make that much more accessible for individuals, especially individuals who have healthcare disparities to begin with. The underrepresented, like Blacks and Hispanics, who routinely don't get screened. We're trying to make sure those individuals are getting screened for lung cancer.
Now, one of the obvious ways to at least help prevent yourself from being exposed would be to either quit smoking or don't start in the first place. What are some of the other things that people can do for lung health?
There's lots of things to do around lung health. One, eating better, nutrition, as well as taking part in physical activity. I think that also we're working with to advocacy groups to make sure that the environment around us is also safe. And so those kinds of things, and the American Lung Association is so part of that. They've always been advocates to making sure that the environment that people, not just the work environment, but the environment that people live in are safe so that they're not getting exposed to things that can increase lung cancer risks.
And Emily, I know there's a virtual option. So for WDHA listeners who maybe can't get to Bridgewater on Saturday the 17th, what do those virtual options include?
Absolutely. Thanks for asking. So we do have what we call a walk your way option. So if you go to that website again, lungforce.org/Bridgewater, and you go through the registration process, there'll be an option to select walk your way. So essentially that means you're going to do the walk in your own backyard, on your treadmill, in your neighborhood, at your favorite park. If you can't make it to Duke Island on the 17th, we welcome you to join us on that day in your own way. You can also join our Facebook group, our Lung Force Walk Bridgewater Facebook group, and interact with other walkers, get to know some folks in Lung Force community, and share pictures from your satellite or virtual walks, I should say. So definitely ways to participate. You can't be with us in person at Duke Island Park.
And again, for DHA listeners who do want to do this virtually, what's that website again?
Yep, it's lungforce.org, lungforce.org/Bridgewater.
So again, it's Saturday, September 17th, the American Lung Association hosting the 8th annual Lung Force Walk in Bridgewater at Duke Island Park. Emily Amoton, the New Jersey Development Director of the American Lung Association, and Dr. Sabia Hussain, thank you very much for joining me here on the Jersey Magazine this morning, and best of luck with this year's event.
Thank you so much.